Get your 5 fingers up when you see Doc C. Welcome back, Halifax County Schools. You know what time it is. It's Sweet Tea with Dr. C. How you been doing, Dr. Battle?
I have been doing very well, Dr. Cunningham.
Yeah.
How have you been doing?
I've been hanging in there. You know, I am so excited about all our babies soon returning, aren't you?
Yes.
And we've been planning a lot, haven't we?
A lot. And you know, we started out with our summer program, and so our students had an opportunity to come back to school, just a whiff, so we could see how things would be.
And how many students did we have during summer?
We had about 600 students this summer.
600?
600 students this summer, and those students had over 150 hours of instructional time.
Say that again.
150 hours of instructional time. And you know, Dr. Cunningham, when you think about the traditional school year, with that traditional year being about 182 days, that gives the students 81,900 instructional minutes. What? And so when those students missed that during the week, during the year of COVID, they were able to recoup some of that time during the summer.
Yeah, and that's what we've been trying to do, right?
Yes,
focus every minute on teaching and learning, because that is that's our charge, teaching and learning.
Absolutely.
And we focus on the needs of the whole child to accomplish our primary objectives, and that's teaching and learning.
Yes.
Yeah.
Yes.
So you would say that our summer school went well?
I would say our summer school went exceptionally well, especially when you look at the culminating activities that the students did. They completed newsletters. They were able to get project-based learning things out that they could put on display for the community. And so that shows you, with those exemplars, it shows you the learning that the students had during that time.
Exactly. And those were just some of the many highlights over the summer. 600 kids, that has to be at almost 30% of our total student population, maybe a little higher than that, isn't it?
Yes, sir.
You know, to have that, and many of the kids voluntarily returned, didn't they?
Absolutely.
We didn't have to shake the bushes.
We did not. As a matter of fact, Dr. Cunningham, when you think about Halifax County, and this is a plug to all of the students and staff in Halifax County, we did not have to run anybody down to work this summer. We had people knocking on the doors waiting to be employed. Knocking on the doors of Halifax County to be employed. That's right. That's right.
Isn't that awesome?
That's right. So nobody can treat you better than Halifax.
So, no one can. and we're saying that now.
That's right.
No one can treat you better than Halifax County Schools. No one can love your child better than us.
That's right.
You know, talk about some of the things that we provided over the summer and last year to show how much we care for our students at Halifax County Schools.
Well, just to show you how Halifax County is a responsive district, you know, when we were faced with this COVID initiative, one of the first things that we wanted to do, and this is under our strategic plan of health and wellness, is to keep everybody whole.
Yes, right.
And so with that particular piece, we actually made sure that we kept everybody whole, but we also fed our community.
We did.
And we made sure that all of our employees did not go without a paycheck.
No one.
So they had their paycheck, that's right, and we were able to feed our community. And so our community, you know, when we look at our social media outlets, when we look at just the anecdotal information and just being out in the community, they were very appreciative. Very appreciative of the things that we did. But not only that, when we respond to the needs of the whole child, we had students who were in technology deserts. So as a part of that, as a response to that, we had our one-to-one initiative.
That's right.
And so we gave out Chromebooks to all of our students. And so once K-12. And once we recognized and we got that part done, we did realize that there was a corridor of students in that Hollister community.
That were in a desert.
Right. And so we had to pivot to come up with more ways to meet the needs of those students. So you saw things like the bus Wi-Fi Ranger.
Running around.
That's right, where you can go into the community. As long as your device can hit that Wi-Fi Ranger, it would download your information for that. So that's good. We also had the Wi-Fi Rangers at the school.
We sure did.
And so we had what we created, the Park and Learn.
Preach, Dr. Battle.
That's right. And then with that, we talked with our parents. And a lot of our parents are frontline workers. And so they needed an avenue so their children would be safe. And so when you think about the 7 correlates of effective schools, safety is one of them. And so we partnered with our churches and we created the community learning pods. And so that was a plug to DPI for allowing us to tweak some of the existing resources we had.
Thank you for your support, DPI.
That's right, in order to meet the needs of our families. And so that means that mom and dad could go to work and their kids could be at the learning pods, making sure teachers would make sure that they got their lessons done and they could actually access the internet. And so that was a win-win for everybody, Dr. Cunningham. Those are just a couple of things, but you didn't even say anything about the book bags we gave away, the shoes we gave away.
The coats
Yes.
over Christmas. I mean, that's why we know no one's going to love you better than
No one.
Halifax County Schools, because we addressed all of your needs.
That's right.
Everything, coats, shoes, desks, laptops, Chromebooks.
That's right.
You know, books that we send home. I mean, every student pretty much has a home
library.
A home library.
That's right.
You know, I mean, come to think about it, yeah. I mean, you have a desk, a laptop, books at your house.
Yes.
At your house, and we're very proud of the way that we support the whole child in Halifax County. But you know now what time is fast approaching, Dr. Battle.
It is time for us to bring the students back.
Yes,
it is time to bring them back.
Come on back.
That's right. And you know, in the words of Shaka Khan, she says, ain't nobody gonna love you better than Halifax County Schools.
Ain't nobody gonna do it.
That's right. And so parents, students, and the community, Halifax County Schools has an awesome reopening plan to ensure that your students are safe to the best of our ability as they enter into the corridors of our school.
So as we go, we're going to talk to you more about our reopening plan because we have some awesome guests with us today. But we want to highlight some important dates. So
Absolutely.
all staff,
Yes.
all staff,
Calling all staff. Calling all staff.
You need to return on August 9th,
August
2021. Oh, I didn't say 2022.
No, 2021.
2021, August 9th,
That's right.
you need to report. We have a wonderful day planned for you. And then our first day of school for the early college, our scholars, you have to go in first. You're the pioneers. You start on August the 18th. And then the first day of school for everyone else will be the following week on August 23rd.
Yes.
Now, as we prepare to open up schools, we always have these open house dates, right, Dr.
Yes,
Battle?
we do.
And what's the purpose of an open house date?
So the open house is sort of like an orientation. If you remember back old school orientation, the parents can come out, they can meet the teachers, they can also see all of the things that the students will need in order to be successful in their learning endeavor. Students, if this is your first time in the school building, you can get acclimated to the different wings in the school so you would know exactly where your scholar is supposed to report on the first day. And also just to meet the staff. It's
That's
a networking time.
That's right. And as we reopen schools in a time of COVID, parents, you need to attend these open house dates.
Right.
You need to understand the lay of the land. You know, I'm going to quote one of our board members when he was giving his comments, and he made a very good point. Mr. Few, he was talking about families having a strategic plan.
That's right.
You know, right. He said families having a strategic plan. What are you going to do? Now, and I like that. Parents, you need to have a plan at your house. You have to. We're in COVID, and now we're getting ready to take off again and go into what we call phase 2 of our COVID journey. And so you need to have a plan in your home right now about what to do when things happen.
That's right.
You know, and part of your strategic plan is coming to the school, meeting with your principal, and that is done during your open house date. So elementary, August the 9th, right, Dr. Battle?
Yes, for our elementary schools, their open house is August 19th.
Okay, August 19th.
August 19th. And so, Dr. Cunningham, we have laid this out so strategically. You know, you talked about the strategic plan. So let me show you how we've stacked this up. So teachers come back August 9th, right? So that week, August 9th through the 13th, we will give them that job-embedded PD.
Ooh.
Everything you would need to know in order to be successful in Halifax County Schools.
Everything.
Now, of course, this is ongoing, but they will get their toolkit during that particular week. Then we come back August 16th.
That's right.
You know, and so when we come back on August 16th, we'll have our convocation with that. And so when we have our convocation, it's I'm a cheerleader, I'm a former cheerleader. So we get in our huddle as a big Halifax County school system, and we talk about our plays, what we're going to do in order to impact teaching and learning and make sure everyone is safe.
Right, we set the ground rules, we establish
right.
norms.
Establish norms, exactly, Dr. Cunningham. And so during that particular week, We also are jump-starting things, so parents will have an opportunity to come out to the school. They can talk about the devices that we're going to give to students. And Dr. Cunningham putting a plug in it right now. You know, last year we did K-12, and we heard so much information from the pre-K students that this year your district is so responsive that we're doing pre-K through 12.
Pre-K through 12. So
Pre-K
so
through
pre-K babies.
We heard you.
We heard you.
That's right.
So you're gonna be walking around with a device, and I'm sure that device probably gonna weigh more. But
they can navigate it.
But we'll put it, you know, so parents, you know you're gonna need a book bag for them to carry that device.
That's right.
You know you're gonna need something for them to house it, and however you're going to have to follow the same rules as everyone as everyone else, and there is a fee, correct?
That is, yes.
There is a fee
It's a
which
fee.
pays for any breakage that's done to that computer, and we saved our parents a ton of money last year, did we not?
We did. We
Yes,
did,
we did.
absolutely.
We had some kids with multiple breaks, but it was covered by that $40.
That's right. Did you know that when I looked at the data from the repair company, our internal repair company, that we had over 400 computers that we repaired?
400 computers
400 computers
repaired.
that we repaired, yes.
And we're so proud. And so, you know, we twisted that, you know, because in Halifax, we look at challenges and we turn them into opportunities. So when the challenge of COVID came and we wanted to launch our one-to-one program, we created a new CTE program called the Help Desk.
Yes.
So now our children are learning to repair and these computer devices on a regular basis. That's a high skill. That's a high need skill. So we're creating our own Geek Squad. Am I right, Dr. Bowden?
That's right, and they can take that skill with them wherever
they go, because I want every student who graduates from Halifax County Schools to know one thing: what you can do.
What you can do.
What you can do.
What you can
And
do.
that's a skill that we want everyone to have. So we have our secondary important dates that we need you to remember. Early college is August 10th. William R. Davie, August 17th. Northwest and Southeast is
August 18th.
And
Enfield Middle STEAM Academy and the Empowerment Zone will be August 19th.
So parents, this is a strategic partnership.
Yes.
We can't be as successful as we want to be without your help. So I would like to thank you right now for your cooperation.
Thank you.
And you know, a dream without a plan is nothing but a wish. A dream with a plan is a vision. And we have a well thought out reopening plan, and we will tell you about it when we come back. And we'll be right back.
We'll be right
Get
back.
your tea. Welcome back.
Welcome back.
Welcome back. As
Yes.
I told you, it is time to bring our children back to school. Am I
Absolutely.
right, Dr. Battle?
Absolutely, and they are ready.
They're ready, aren't
They're
they?
ready, and I told them last night, get ready, get ready, get ready, get ready, get ready.
Get your fingers up, because you coming back to school.
That's right.
Yes, face to face.
Face to face.
And we are excited about you. But you know, safety is our #1 priority, parents.
Yes.
You know, we can't do anything if we do not feel safe, because what we have learned is that safety is a feeling. And we want everyone, and I mean parents, employees, students, to feel safe in our buildings every single day. Every single day. So today, what we're going to talk about now is our reopening plan.
Absolutely.
And I'm joined by two guests. Our first, you know this guy. Who's this guy right here? This is Dr. Gregory Monroe. How you doing, Dr. Monroe?
I'm doing well.
Everything going all right?
Everything's going well.
You knocked it out left field last night at the board meeting, did you not?
Yes.
Swung for the fence.
He swung for the fences. And joining us, our very good friend, Mr. Bruce Robistow, Halifax County Health Department Director with the locks. How you doing, Bruce?
Good morning, everybody.
Come in here with that head and shoulder look.
Yes, looking good.
Look, see? Already.
Reliving my youth.
That's right. That's awesome. How you doing, Bruce?
Doing very well.
Everything's going okay?
Everything's going well. Very busy once again. We did have a short break for the spring, early summer with everything COVID, but now we're back on the fast track as things start to change once again.
So, Bruce, tell us a little bit about what's going on in COVID world right
I'll tell you, the COVID pandemic has been interesting. We haven't experienced anything like this in over 100 years. And so everything was new to everyone. Fortunately, one of the many things that have improved is automation and science. We had the great fortune with this pandemic to be able to come up with a vaccine fairly quickly, quicker than we've ever done before. But because it came up so quick, a lot of people were skeptical about it. But we had 3 vaccines out, highly effective vaccines, that was available to everybody for free. And people initially jumped on the bandwagon and wanted to get vaccinated. But in this age of internet, there's a lot of information out there. And sadly, there's a lot of misinformation. So a lot of people walked away with questions and concerns that we weren't able to combat the misinformation. But the vaccines are incredible. So we got a vaccine, and a lot of people got the vaccine, especially those over age 65 that were at highest risk. And lo and behold, the numbers started going down. Getting vaccinated was very effective and started knocking it down. And that's why we were blessed with the results we had this summer.
That's right.
However, a virus is a tricky little thing. And a virus, once it realizes it's getting beat down, it decides to mutate. So in order for it to mutate, it needs hosts. It needs people to get into so it can change itself. So what the virus has done now is it's mutated. What would have been the best case scenario is if everybody would have got vaccinated, that virus wouldn't have been able to find hosts to get into and mutate. We could have stopped it in its tracks right where it was.
Are you serious?
We could, that is true. But sadly, because of the skepticism and that I want to wait and see mentality with the vaccine, we gave this virus the opportunity to mutate. So here it is, the Delta variant, twice as strong as the original COVID virus. It's affecting, one person can infect 5 other people, where before it was only 2. Because so many of the elderly were vaccinated, we are seeing all of the people getting infected now that are ending up in hospitals are under the age of 55.
So grandmas and grandpas are safer now.
They're a lot safer now.
That's
For now. If we don't stop this thing, if we don't all pull together, get vaccinated, keep this virus from mutating, this thing's going to keep changing and getting stronger, and it could get to the point that this existing vaccine doesn't work if we don't all act now. This is mission critical now. Time is of the essence. We all need to be vaccinated.
So what are some strategies that have been implemented to shed light to combat this disinformation?
We try to put out a lot of information. We put it out into the schools. We put it out into the community. We do radio pieces. We have gone into communities. We have a team that will actually come into your home and vaccinate you in the event that you are unable to get out of your home to do it. We've had vaccine sites throughout the county. We have partnered with Vidant North, Rural Health Group, the Vidant Doctors Clinic, Drug Co., so many partners. We've gotten together and we've had sites everywhere to try to make it available. And again, it's free. So, but the demand completely dropped off. The last 8 events that we had set up to vaccinate people, basically nobody showed up for them. We're putting a lot of resources into that to try to make it available, but it's just gone down. And the wait and see approach for a lot of people, and some folks are waiting for it to be fully approved by the FDA. Right now it's under emergency use authorization, but this is one of the many things we're up against. But because we're mutating, because it's changing, it is just critical that we all rethink this, that we trust the science, trust your leaders, trust the science, and get vaccinated.
Yeah, and I can speak to disinformation, I mean, and how social media has impacted us greatly. I was in a classroom, remember, Dr. Battle, and Bruce, you'll see my point in a minute. And I told the kids, I said, define strive. Define strive, because that's how I was taught, right? So the kids just looked at me, like, what are you talking about? Define strive. The teacher lifted up her head just like this and said, Google it. Google now means define. No, it doesn't. right. So I had to learn, Google now means define, and so often we rely on that device as the end all and be all for all the information that we receive. And we think of it as factual. But sometimes a lot of information, especially that on social media, isn't aligned to science. Am I right, Bruce?
That is correct. That's exactly right. There's just a lot of information out there. I looked up one time just for fun whether or not the world was round or flat, and I actually found information that the world is flat. So,
yeah.
You can find information to give you the answer that you want, but you have to be open-minded when you research, and then you have to go to known and reliable sources, and be open-minded when you review this stuff. But also reach out to your experts, reach out to your leaders, your school leaders, the health department. We're always available for you to help in any way with any information that we can. There's just so much important information out there. The internet is a good thing.
It is.
If you know how to navigate it, but you have to be reasonable when you do.
And Dr. Battle, this is where educators come in. Because what Bruce just explained is the teaching and learning process, isn't it?
Absolutely.
How, a lot of people say, I can read, but if you don't understand what you're reading,
Right.
you don't understand your resource, that if you can't question that the sources are credible,
Right.
you're really not reading. You are reading some words, but you're not comprehending anything. And then you're taking that misinformation that's been planted in your mind and you're acting accordingly. Because what I've learned is that when you think, right, feel, and then act.
Yes.
And that's what it is. Am I right, Dr. Bass?
That's right. And reading is fundamental.
It is.
Reading is fundamental. And Mr. Roverstow, I was sitting here thinking that I'm a parent, okay? And so I'm going to switch gears just a little bit. I'm a parent of 2 girls, okay? One of my children is 17, and the other is 8. So if I was a parent advising those 2 sets of kids, knowing that we're trying to get them back into school, what should I be saying to them?
You need to be saying to them how important it is, that how the focus needs to be not just on the safety and health of yourself, but of everyone else. And again, to Dr. Cunningham's point, yes, once we get it in our head, something, what's the best way to spread information in Halifax County? And that's word of mouth. So now if you're convinced it's a bad thing, that's what you're going to spread. And like spreading the virus, we're spreading the information. There are people that look up to you. Your daughters have friends. Their friends are going to be looking to them as well. They're going to be talking to each other. So it's important that if they're going to speak on this topic, that number one, they're informed. So it's important that they get good information. And then after they're informed, then they need to discuss it with people that they have trust in. Like you, for example, someone who is educated, knows how to interpret some things. Have an open dialogue with family and be open-minded when you do it. Being open-minded to knowledge is just so important. So I would have these conversations, and then they need to take what they glean from that, what they learn from that, and then just share it in a positive way. And that's the number one way to spread any information in Halifax County, is through our own communication with each other. We trust each other, our friends, our family, we're close. But that's a responsibility now. Now you have that power. So if you take that power and spread misinformation, that's destructive. But we need to be helping each other. So this is the mission now, is for us to understand and then support each other, promote each other to do what's right. because this is how we protect each other. Look at the mask right now. Until we get to that herd immunity, this is the only tool in our toolbox for helping each other, for immediate results. If everybody wears this, we cannot spread the virus. But nobody likes wearing this. So our plan has to be to get rid of the mask. There's one way to do that, and that's everybody get vaccinated.
Vaccinated.
So we hear those terms a lot, herd immunity.
Yes.
Tell us what that is. And,
Herd immunity.
and how many people have to be vaccinated for the herd immunity to kick in?
Exactly.
Yeah.
Putting a number on anything, it always makes it challenging.
Yeah.
However, what herd immunity is when, as I explained before, the virus, when we start to beat it, when we get an immunity, either from building our own immunity to it or from a vaccine, usually, especially in the case of a virus, what we do is we're fighting back. We're at war.
Mm-hmm.
So our army is getting bigger as we get vaccinated, so we're beating down the virus. But then, when we think we've won, but we haven't yet, then we back off by people not getting vaccinated. The virus is looking for those that are not being vaccinated. And the scary thing is now, who's not vaccinated? It's our kids.
Right.
Those under 12 that can't get vaccinated. And that's the thing I'm also afraid of, is this virus mutating to where it realizes, hey, the kids aren't protected. So getting to herd immunity, what that means is that we have enough people vaccinated, enough people with the antibodies in their bodies to fight the virus so it can't mutate. It can't regroup and come back stronger and start another battle. Herd immunity is just getting the majority of the population vaccinated to where there's not enough people and not enough hosts, if you will, to allow the virus to get in and get strong again. So that's the purpose of it. That's the purpose. And the number, if I have to put one on it, greater than 70%.
Greater than 70%.
Yeah. So anything over 70%, we are very close to being a strong herd immune country, county, state.
And right now in Halifax, we're probably about
40%.
40%, so we have a ways to go.
Yeah, we have a ways to go there. And again, it doesn't mean we stop at 70%, and that's why I'm always cautious about numbers, because, man, if we could get to 100%.
We want 100%.
That would be incredible, because then it's just gonna be annihilated. And, we have gotten rid of so many diseases in the past with vaccines. I grew up at a time with polio. I had relatives with polio. So when the polio vaccine was available, there was no question in our mind we wanted to get it, because so many people were affected and we saw it. And we didn't have the media then, but it all affected us at home.
Mm-hmm.
And so many other diseases, smallpox, things like that, things that everybody gets vaccinated for now, we've got them under control. We just have to do it again. This is another new virus, and there'll be more in the future.
So we've already been through this
Yes,
with polio.
yes,
So now this is like a rinse and repeat,
yes.
as Dr. Monroe would say.
Yeah,
Yeah.
this is the science of it, and it's something that will continue, and again, we talk about this vaccine. Most of the vaccines are greater than 90% effective. To put that in perspective, the flu shot, which I promote strongly, is on its best day 40% effective. But when it's not fully effective, so if it's only 40% and I got the flu shot, I can still get the flu, but it won't be as bad.
Right.
And it's the
right.
same thing with this. We're having breakthrough cases. We're having people that have been vaccinated that become symptomatic and become positive for COVID. It's not a guarantee you won't get it, but what it's going to do is prevent you from ending up in the hospital, in ICU on a breathing machine, because you're vaccinated, you have the antibodies, and you can fight much easier. So you may not even have symptoms, and you could end up positive. So the more we have vaccinated, back to your original question, herd immunity is the way to get there and stop this in its tracks. get rid of this.
So while we're approaching herd immunity, there are some practices that we need to implement now, right? And that's part of our plan. And joining me at this time, we have our resident process expert,
That's
Dr. Gregory Monroe,
Dr. Monroe.
who's going to talk to us a little bit about how we plan on keeping everyone safe with all these wonderful chemicals that are in front of us. Dr. Monroe?
Yes.
Well, good morning again, everyone. We have had a great opportunity at the close of the 2020-21 school year by coming back to school in March. We have processes in place that kept us safe, that kept our faculty safe, kept those students safe, all our employees safe, and these processes are pretty much the same processes we're going to use again when we come August 23rd. As you pointed out, we're going to rinse and repeat. There are some small tweaks and things that we have to change, and I'm very thankful to the partnership that we have with Bruce Robusto and his staff. We hosted a Zoom meeting with our school nurses, with his staff, just so we can make sure we were all on the same page when it came to contact tracing and with regards to who needed to quarantine and who doesn't need to quarantine. Mm-hmm. And one of the biggest changes that we are seeing with the inclusion of the vaccine is now who has to quarantine. If you are fully vaccinated and you're in close contact, you don't have to quarantine. That is a great thing to be able to do, and we know that if there's breakthrough infections that you're not taken down, and you don't have to have the extreme of what happened to us in last July. We did not have a protection. We did not have a strategy. We were trying to figure out this COVID disease and all these other things. And so now, and to honor those who we've lost, and I've lost family, and I lost a very close friend here in the district to this, who did not have the opportunity that I had to be vaccinated and to just put on a mask, not only to protect myself. When we started this process, or when we started in our most vulnerable citizens, were our older citizens, our seniors. Now, as Bruce pointed out, those people we've taken care of, but we still have a vulnerable section of our population that we have to look out for. Our babies that are under 12 that cannot be vaccinated. This mask protects us. So with regard to our process maps, our principles, we are tweaking those as we speak. Again, because there are certain things that we have to change, such as getting on the bus. We initially were given 3 options to open school. Plan A, face-to-face, Plan B, a blended model, and Plan C, full remote. In Halifax, we were fully remote for a large portion of our school year. And then when we had the option, or when we were voluntold that we had to do something, we had to either do it their way or do it our way. And and from what I've learned in being in Halifax County, it's always best that we can do it for ourselves and do it the way that works best for us. And so we went to a blended type of model. Well, things being that they are now, we know based on the end of the school year, our students, not only in Halifax County, but across the state, learn best face-to-face.
Yes, sir.
You've got to have, you can have a camera, you can have a person, but if you don't have that connectivity, if you don't have that human interaction, you are missing something. And that we created gaps with remote learning, but it was the best we had, and it was the best we could do. We did not have, other than mask and protection, we didn't have a vaccine that will protect us. So we're going to, again, start back the same way that with regards to opening schools. What you see before us is the cleaning and the hygiene tools that we have in our building. We stockpile, and we still have things in our warehouses that we can roll out to our schools. Absolutely. That will get us up and running, and throughout the year. So we use our first round of ESSER monies and other things, and we began to take care of Halifax County schools. We knew that we could take care of the virus on surfaces using pine it's a mist spray, and it's proven, it's hospital grade to clean and sanitize high traffic and high touch areas. We also invested that every building in Halifax County Schools has a Clorox defogger. That again, it's a mist spray, and it's known to kill on contact with the viruses on surfaces. And so we'll continue with that. Our custodial staff continues to clean vigilantly throughout the day. Again, high traffic, high touched areas. With the new Strong Schools, or the revised North Carolina Strong Schools toolkit, they've taken away some of the restrictions.
Yeah.
Visitors are now welcome back into our building. You know, but we've got to take care of those things. We no longer have to do temperature checks, or we're not required to do temperature checks to get on the bus or to enter the building. But we still have to monitor. And one of the most important things is, if you do not feel well, we're not. I have my doctorate, but I'm not a medical doctor. And so, you know, we try to self-diagnose. Oh, it's just a cold. Oh, it's just sinuses. Oh, but those are some of the same symptoms that COVID emulates. And this is a lesson that we learned from Bruce's and his staff when we had students that reportedly came to school with a headache. We didn't know that was could be a asymptomatic symptom of COVID. And so what we realized is that, yep, they passed our temperature check on the bus, they passed our temperature check coming into the building, but something happened at home, and we had nothing to do with it. We had no idea, and so we followed contact tracing, we quarantined, we tested, and we continued to keep schools open. You know, so even our numbers were low, and so low to the point that I can say we had zero transmission that happened at the schools.
Mm-hmm.
All of ours was community spread.
Community spread.
It happened somewhere. Someone did not answer the attestation form truthfully. You know, I'm not blaming anyone for that, but you know, those are some of the evidence that we have. You know, that uncle, they went to a family reunion, they had a birthday party, and somebody that they claim in close contact with. So we're not doing the temperature checks. We're not doing the attestation forms. We're not required to do those things anymore. But we are going to continue to be vigilant about monitoring. And the state gave us an opportunity, and shout out to Nurse Board, who came last Monday, and the state said, we're going to give you some free PPEs and other things. And they said you can order up to this amount. Nurse Board now ordered the maximum amount we can order.
That's right.
Good
They
job.
say you can get 2,000, send us 2,000.
That's
right.
So we're gonna have disposable masks coming in, we're gonna have cloth masks coming in. So when parents, your child goes to the school bus, they should have their mask. But if they don't, we are equipping our bus drivers that they can handle a mask, get on that bus and come to school. Again, we're playing, there is no plan A, B, or C anymore. It is face-to-face only. The state of North Carolina has said there is no other option. That face-to-face learning is best, face-to-face learning is what we're going with, and that's what we're required to do, is to provide in-person, face-to-face learning. However, what they have recommended that we should do is require masks indoors, wear them properly, not on the chin, not under the nose, but covering the face and the mouth, the nose and the mouth properly. Because here's what happened. We are protecting that other end of the spectrum now of vulnerable citizens, because what happens is if someone does test positive and we were in the room with them and our babies who were wearing their mask properly, our staff or adults who were wearing their mask properly, you don't have to quarantine because you have a barrier and you are protected. So number one, those who can be vaccinated, get vaccinated. We have a survey that we're sending out to all of our staff because we want to give our parents the assurance that we have teachers in the classrooms that are vaccinated. We want our staff to be vaccinated because, again, there's a wild card out there, and whatever we can do to tilt the table to our advantage, we definitely want to do that. We do have a mask requirement for all indoor riding the bus because, again, we don't have limitations. We can go back to our normal operations, and we don't have completely packed buses, but we can't do 6 feet apart on a bus there's just not enough room to do 6 feet apart. And even that requirement is 3 feet or to the greatest extent possible. But again, wearing the mask, being vaccinated, we have more than what we had last time this year that we should be taking advantage of. So with Halifax County Schools, we're ready. We're ready again to continue what we were doing in March. Now that we have a vaccine, we have another advantage to for our staff and our students, and we have a plan. So we're not wishing.
No wishing. So, and thank you very much. See, and parents, we need you to understand that we have processes.
That's why.
And those processes kept us safe so far. And they will steer us through to the other side of this virus issue that we're dealing with. And so when I go back to you, Bruce, for a minute, and we talk about and you listen to what Dr. Monroe has explained, how do you feel Halifax County Schools is equipped? Do you feel like we're ready?
I think we're more than ready.
Okay.
You know, and again, thank you for sharing all of your information and your plan, you know, referencing the fact that we have the tools and the difference from this year to last year. Last year, there was no vaccine. The mandates had to come out because we had to do this strict and firm. Now that we have so many tools, that now we just need to use them. We need to work with those tools. So now we're given some autonomy. We can make our own decisions. We can do what works well for us. We just have to do that. And by getting vaccinated, the number one thing to do. Excuse me. Secondly is that mask. And again, you have the mask, you have the facilities, you have the knowledge. Again, we are all so equipped, not just with the tools, but the number one tool of knowledge. We just have to apply that. We have to share that knowledge, just like we share the masks, and we have to apply it and get everybody else to want to. That we are no longer at the stage where we can just sit back and wait for this to go away. We saw this summer what happens if you take that wait and see approach. Yeah, we had a good summer. I got to go take my wife out to dinner a few times this summer, but we're not doing it anymore.
No.
Because already it's spiking too much. And so making sure that we take advantage of everything and that more people get on board. Please don't sit back and wait for something to happen to where you don't want to wait till it becomes critical. Now's the time. Check with anybody that you can. Do this as a team. Work with your families, work with your friends, your fellow churchgoers, and make it a positive, fun thing to go out and get vaccinated, and let's beat this down. So the next time that the numbers go down and we start getting more freedoms back, let's keep them.
Let's keep them.
Yes.
And the one thing we don't want to see, you know, I was watching a little TV and everything. And Bruce, when you see someone in the hospital suffering from COVID, and they look at you, and they ask you if they can be vaccinated, what do you say?
At that point, no.
Why?
It's too late.
It's too late.
It's too late. And I'll tell you, I saw a doctor just a few days ago, and he was in the emergency room, and he was taking care of somebody else. But he explained to me, he said, Bruce, there was an 18-year-old boy in there that was turning blue. And they were just fighting to try to see what, and the mother just kept saying, I wish we got vaccinated, I wish we got vaccinated. And I don't know the outcome. But this is happening to a lot of people. And in my career, I used to work in intensive care. I was a respiratory therapist. I was the guy that ran the breathing machines. And I've seen so many people on these things. They're great machines and they're life-saving things, but it's not a fun experience. And it's a last resort. And sadly with COVID, even those ventilators are not always successful in keeping people. So let's not lose those near us, and let's not just focus on folks around us. Again, that we're Americans, and we need to be looking out for each other like we always have. Anytime there's been a major crisis throughout this country, from war to disease, we always try to pull together and help each other out. And it's high time that we start doing things as Americans, as one great country.
And I remember that old World War II saying, after they bombed us in Pearl Harbor, the general in Japan, he looked at his troops and he said, I fear we have awakened a sleeping giant.
Yes.
Because it didn't take us out. COVID will not take us out. It will make us rise because we are second to none. And I agree totally with what Bruce is saying. We need to go right back to where we are and realize that in America, we're second to none. And we lead the way. And our practices should be shared throughout the world. Am I right, Bruce?
I agree 100%. And that's the thing, the vaccines we're not using, we are sending them out across the world. And gosh, I hope when folks come around to finally wanting to get it, that we have a plenty. Because this stuff's getting ready to expire. So the stuff that's gonna expire, we're giving it away.
Give it away.
To other countries.
That's the Halifax way too.
That's the Halifax way. We
Give it away.
share with whoever we can. But let's also use it ourselves.
Yes.
And let's pull together on this.
So as we begin to launch our reopening plan, Bruce, are we able to test in the schools?
We are. We're able to test in the schools. We're able to vaccinate in the
Great.
schools. You know, just 2 weeks ago, we had a person come in to want a vaccine. And a vial is good for 10 doses. And you have to use it. So one person came in, so the nurse asked me, Bruce, we only have one person that wants a vaccine. What should I do? I said, give her the vaccine. We ended up wasting the other 9 doses, threw it away. But I would rather do that, to vaccinate one. So yes, the short answer is yes. Continuing to work with the team that we work with, Vidant North, Rural Health Group, Drug Co. We will find that way to do it. If you want to do testing, we can do testing. We can do it for businesses. If we want vaccination, all I ask is that we make sure we have a demand. All right, as I've said, we've set up multiple sites throughout the last couple months with 0 response. So if you have a commitment of people that want to be tested, or if you set a rule, for example, I'm going to make it mandatory to test all non-vaccinated employees at the health department on a weekly basis. And it's not a punishment, it's for me to be able to manage what I have to work with. I don't know what Delta's gonna do next. So I need to be prepared. So I know who's vaccinated, I know who's not. The ones that are not, I need to test regularly so I can keep track of what's going on and protect everyone else. We're taking care of sick people at the health department, pregnant mothers, children, all those that are susceptible. So, and I am gonna try to mandate vaccines for the employees at the health department. I think it's high time. You may have noticed that all the hospital systems are doing that now. The North Carolina Hospital Association came out and promoted mandating vaccines for hospitals and doctors' offices. They recommend it. So I'm working with our Board of Health to try to do that. I recommend it to any business owner. You can do it. The EEOC has come out and supported mandating the vaccine. So it's not illegal to do. And when you're responsible for the children here, and some that can be vaccinated, but many that cannot. So why wouldn't we make sure that everybody is protected? You wouldn't let kids go whitewater rafting without helmets and a life jacket. So we cannot let kids gather and put them at risk. And if we all wear a mask, that's your helmet and your life jacket. That will protect, that will prevent the spread of the virus.
So Halifax County Schools, what we're doing, we're actually in the process of drafting a policy that supports testing and administering vaccines in our schools. And if you're not vaccinated, you will have to be tested weekly. We are committed to staying aligned to the science.
Absolutely.
That's what we're doing. You know, I am not a healthcare professional, I'm an educator. And I didn't stay in the Holiday Inn either. So I have to rely on the expertise of those who are highly educated in that field, just as you have to rely on us as educators to educate your children. This is what we have been trained to do. This is what he has been trained to do. And the key is learning when to defer to someone's expertise for our own safety. And that's what we've always been doing in Halifax County Schools. Bruce, I can remember back in 1992, 93, one of those years back then, we were dealing with them 4 letters. AIDS.
Yeah.
And I remember when we had to go into these workshops then, right? And it was like, because I was a coach. If a kid busted his nose on the court, I'll run out there and throw a towel on him, But you had to stop and say, hold up, Eric, don't do that no more. Right. You got to put all this on now. And and we call that universal precautions. Remember that, Bruce?
I do.
You said treat everybody like they were positive,
yes,
right?
Exactly.
And so what we're doing right now is going back to our prior training in the 90s. We're treating everybody like they're positive. Right? And that's why we're wearing a mask properly. It's not, it's just protection, protection, protection. And when we implement these universal precautions, we're protecting ourselves, we're protecting our families, but we're also protecting you, which is all important. And that's taking care of the whole child. So when we talk about universal precautions, that's all we're implementing. Those are safe practices that have been here since the 90s. Am I right? And then we're just bringing them back. And so you've heard a lot about what we are doing in Halifax County Schools, right, Dr. Battle?
Yes, sir.
And how do you feel as a parent?
I feel like my kids will be safe. I feel like we're doing the best thing with all the information that we have. And for me and my family, with our strategic plan, we realize that it's changing.
Yes.
Things are changing, so you have to be responsive to that. And so we are deferring to the experts to make sure that we can bring forth the best information possible so that we can make sure that we ensure the safety of all the students and staff here in the district.
But parents, you have to do your part.
That's right.
You have to do your part. As Mr. Robiso has said, we're about at 40%. We need to get that up to 100.
Yes.
Now, if there's something that, Halifax County Schools, we think of ourselves as a lighthouse district. We like to be the leader and show people the right way, which works with children in places like Halifax. And we see that there are a lot of similar districts like us in there.
Yes, absolutely.
So you might as well, we learn by sharing, right? And we're sharing what will keep us all safe. We don't have to keep debating this. We have experts in their field that's telling us exactly what needs to be done. And that's the best plan. And we must submit and follow through, because safety has to be our #1 priority. So we will be launching, we will be creating a policy that will support vaccinations, that will support school-based testing, and then if you choose not to be vaccinated, there will be a process that you will have to follow, which will include regular testing, so that we know where you stand and you know where we stand and we're all safe. Those are universal precautions. That's all it is. Universal precautions. You're not being singled out, you're being protected. And that's how we need to look at it in Halifax County School. If we're gonna lead, let's lead in vaccinations. Let's every parent go out there, if you can, get vaccinated.
Yes.
Now, perfect practice. When I played basketball, perfect practice means perfect execution when it's game time. Parents, I need you to start practicing putting your mask back on.
Yes.
Practice enforcing it with your son or daughter at home. Set the expectation, because we strive for 5 in Halifax County Schools. And what we want, 5 stars. And that means 100% of all of our students and staff wearing your mask. It's not a debate here. It's not going to be a debate here. So, wear your mask. Have a good time in Halifax County Schools, and watch as you continue to strive for 5. So, Dr. Bowder, what are the ways that we're going to communicate this information? Because we are the authoritative source.
Yes.
Stop listening to other people's comments about what is happening in Halifax County Schools. You need to go to us, Halifax County. Now, how can they do that?
So, Dr. Cunningham, with the authoritative source being Halifax County Schools, we communicate via social media, so with our web page and with our Facebook page. We also have a reopening page on the district's web page, and it also talks about the alternative learning that students can have as well. We also communicate via Connect Ed, so the calls that you get, some people call them robocalls, but it's a way for us to inform our publics of the expectations of the district. And also we communicate via our student emails. All of our students have email accounts, and so periodically from the district level we will push out information via the email. So if all else fails and you cannot get our communication through that mode, please stop by our district office and you can talk with any of our administrators here, as we serve as the authoritative source for Halifax County Schools.
That's right. That's right. So you've heard it. You know how to get the correct information. You're hearing expertise. We have a clear plan, which will keep us all safe. And now it's time for us to begin to practice.
Yes.
Now, we have some upcoming events, as we begin to bring you inside. First upcoming event is our Lighthouse Solar Camp completion ceremony. Dr. Bada, talk about those Lighthouse scholars.
Yes, so we have 20 scholars who spent their entire summer from May 26th all the way up to August 6th. Those students participated in the Lighthouse Solar Camp program, where those students earned certification in OSHA 10, Lean Six Sigma, and Working Smart.
Isn't that
These are
awesome?
all credentials that these students earned during that time, and they will have their completion ceremony on Friday, August 6th at 11:30 on the campus of Halifax Community College at the Irvin Griffin Center. So please, parents, stakeholders, investors, interested parties, please come out and support our 20 scholars as they complete that ceremony.
Invest in our children. And then our
That's right.
second event is Jazz on the Lawn.
Yes.
On August the 13th from 11 to 2 in front of Enfield Middle STEAM Academy. Now, Jazz on the Lawn is just awesome, isn't it?
Yes.
We sit out there, and on August the 13th, I want you to bring your lawn chair, sit out in the parking lot in front of in front of Enfield, and listen to the smooth sounds of
J. Sean P.
I mean, if you were at the last one,
Yes.
you were surprised. Now this is going to be a tasty treat. Come on out and sit with us. Network with us.
Network.
And as we share with you our plan as we bring everyone together. That's Jazz on the Lawn. Bring your own lawn chair, bring you some sweet tea, some water, whatever you like, Remember, you're at a school though.
That's right. That's right.
You're at a school, and for the smooth sounds of Jazz on the Lawn. And then on August the 14th, what's going on in Enfield?
On August the 14th, the town of Enfield will be celebrating their back-to-school orientation, or their rally that they will have. So they will have activities out at the fairground where they will be giving out school supplies and other pertinent information as it relates to the successfulness of students with their academic. It will be on August 14th at the town of Enfield at the fairground.
And and so please come out. Please come out. It's not just for the people in Enfield, is it?
No.
Just come out.
Interested parties.
Anyone. As we bring ourselves, bring us back together again, we have to go across geographical boundaries. We're pooling our resources and we're distributing them to everyone in centralized spots. So there is no my side, your side. It's our side and we share. That's how it works in Halifax County Schools. So what is ours is yours. And we want you to support Halifax County Schools because it's your school district. It's your school district. It's our school district. And together, working together works. Don't ever forget that. Working together works. So as we wrap up, I'd like to thank you very much. Bruce, you have any closing comments?
I do. I want to recruit. This is a mission, and I need leaders. I need strong leaders for us to be successful. And the simple definition of leadership is follow me. Take your mask, put it on when you go in public. Lead by example. Get your vaccine and follow me. Let's get everybody to get vaccinated and get healthy and protect each other. Thank you so much for having me here and having this venue to share this great information on how we can help each other.
Get your 5 fingers up as we stay safe going into year 2 of our COVID journey. Be safe.
Be safe.
And we will see you soon.
See you soon.
Have a great day.